So we'll look at another classification of adrenergic drugs, and this is what is known as the non-selective, all right, beta blockers adrenergic drugs. So for the non-selective is like, let me say you have beta adrenergic receptors. So in the beta adrenergic receptors, we have the beta 1, we have the beta 2. So have drugs that could selectively act only on beta 1. You have drugs that could selectively act only on beta 2. So the non-selective just simply means these drugs are acting on the beta 1 and the beta 2. All right. So let's look at it, talk about their general pharmacology, and still talk about their clinical applications and examples of the drugs, which is the most important. So for the non-selective, there are drugs that inhibit both beta 1 and beta 2. All right. They can affect the heart, they can affect the lungs, they can affect the vascular system. That's like any system that has the beta receptors in it. All right. So unlike the cardioselective ones, these ones they act only on the heart. All right. These ones, for the non-selective, they have a broader effect. That means they can affect many systems, and are used in a variety of conditions, but they can pose risk. Okay, because sometimes you might want to treat a condition that is only to the heart. If you use it, it's now be affecting the vascular system, the lungs that don't have a problem. Do you understand? So for the examples of the non-selective, these are the drugs on this other side and their key uses, which I advise you to pause this video to observe this timetable very well. This table rather. All right. So we have propranolol, we have Nadolol, we have Timolol, we have Sotalol, we have Pindolol, we have what? Labetalol, we have Carvedilol. So all these drugs, right? So all of them, you can actually see their key uses. So for their side effect, general ones, you have bradycardia, fatigue, dizziness, bronchospasm, cold extremities, sleep disturbances. They can also mask, hypoglycemic symptoms. Like, let me say your glucose levels are low, but they can just cover up, So clinical insight is non-selectives like propranolol are used off-label for what? Performance anxiety, right? Due to their ability to be able to blunt physical symptoms like tremors, rapid heartbeats. Okay, so that's just the aspect of the non-selective beta blockers that we're going to talk about today.